Welcome to the series, The Hidden Parts of Healing. Today, we're going to talk through the hidden parts of a knee replacement. And this is not about the scar, it's about how a couple of parts of the surgery itself, and then also some movements that your physical therapist may not have taken into account with your recovery. So this is Louise. She's going to be helping us. And I'm Cara Lindell, the founder of the Bridging Institute, where we look at how muscles connect together to allow you to move with ease and good balance. And then when something is amiss, we reset how the muscles work together so that you can move again. So with the knee replacement, we're going to talk through one particular part of something they do as part of the surgery process, and then two parts of what else you might want to be asking about with your recovery, with the exercises that you're working with your therapist. So let's dig right in. I'm going to let you lay down, and we're going to zoom in on your knee. So I'm going to we'll focus on just this one. And what people I have worked with following knee replacements often talk about a very strange pain that they've got mid-thigh. And when you dig into what is commonly done during the practice of the knee replacement, they are trained to keep a lot of blood out of the area where they're sawing your knee apart, literally. And so what they'll do is put a tight band around the mid-thigh that restricts the blood flow. And depending on how fast or how long the surgery is, if this has been restricted for a while or how sensitive your system is, often this just doesn't fluff out. It's sort of left with a dent or an indentation. And some people, like you can actually see there's an indentation there for a while. And that ends up causing a fair amount of just weird feeling because your thigh muscles are just not able to move and shift around and wiggle around the way that they normally would. I mean, granted, you're often in a lot of pain from what happened at the knee itself. So this is sort of secondary, but it really is a big deal for a lot of people in their comfort level and the ability to just get back to normal through the whole leg. So what we do, if we pretend that this is the line where the indentation was, we'll just take and hold lightly above and below and just try to wiggle it back so that it's almost like we're trying to join two halves together that just need to, that if this is that they're thrown off a little bit, that they just need to dovetail and match up. And that usually helps it feel better. You would be able to do it yourself if you can reach your leg, but easily have a friend do that. Another piece of your knee recovery that is often overlooked, most of the standards for care are of flexion and extension, how your knee bends, how your knee straightens. And that's when you're discharged from care, and it's a success. Its insurance standards are often driving that for how many sessions you're having with your physical therapist. What most people don't realize is the knee has two other jobs, the muscles around the knee. They work in a slight sideways relationship. It's very subtle, but I'm keeping the top of her leg still and just moving those side to side a little bit. That helps control force when we have to move sideways or step sideways. So there is a coordination between the inside edge and the outside edge. And that coordination needs to be there if the knee is bent all the way or if it is straight all the way. So all the angles in between really matter. So there's one other relationship with the knee is that between the above and below, it needs to turn. And there's a little, it's like a spiral. And what happens is when certain motion happens at the ankle, then the inside bone of the lower leg starts to rotate. It's called the tibia. That interacts at the knee, and then that turns the femur and then the hip. Because you've had surgery and this has been all disrupted and re-put together, a lot of times that particular coordination just needs to be put back together. And it is a very important one. It's a relationship that we use when we squat, sitting down and standing up. And what it should look like is just a coming in and out. So it's out and around and back in instead of just pure up and down straight. The last part, the third part that needs to happen after the knee replacement is some sequencing of automatic reactions. You might think of them as reflexes, but I don't believe they have an actual reflex name, is when your ankle bends, that the muscle contraction through the front of the leg hits the tendon at the knee, and that should have been probably moved away and then moved back after the surgery. And then that connects to your quads. So we want an interaction here, up, and here. So boom, boom, boom. And can you feel that? Mm-hmm. Yeah. So often what we'll find is that it's disconnected because of all of the trauma at the knee. It could have been from before you had it replaced, when your knee wasn't working so well. But that's just another piece of your knee working properly. There are a lot more parts of how it functions than just purely bending and straightening. So just a quick recap. If the thigh is feeling weird and you had an indentation, we want to just get that moving back together so that there's a nice flow through the big leg muscles, and then to restore some of the sideways movement, and then to connect actually the spiral movement, and then the ankle, knee, thigh movement. So that is the important pieces that you still may be benefiting from in the recovery after your knee surgery. So catch you in the next episode.